Dr. Faber, we're here with Peter Schmidtke of Burlington, Vermont. We're going to talk about his story with fibromyalgia, hypermobility syndrome. Peter started here 17 years ago. He went to a large medical university, was seen by 8 physicians, 2 physical therapists, an acupuncturist, and a chiropractor and sports psychologist, all of whom failed to produce desirable results, and said that he may, since he didn't have associated trauma, he had psychological elements. So, would you like to add anything to that?
Well, it was just a very frustrating experience until I came to the clinic here. Pain was kind of really throughout my entire back, so when I would see a doctor, it was difficult for me to point to one area and say, this is where it hurts, because it was really kind of muscular spasms throughout my whole back. And I did have 2 MRIs, which, they could tell there weren't any tumors or anything, but they just really couldn't point to anything that was wrong with me. So I was kind of left to just flounder
Right,
on my own.
and so basically we were able to correctly diagnose his problem and explain his problem the first visit using osteopathic prolotherapy, neurofascial therapy skills. And the clues were that he did not have any injuries, and but he hurt consistently, had lack of endurance, and he had the clinical signs, which is in Chapter 18 of Pain, Pain Go Away, the new edition, which shows the clinical signs of the excessive joint movement. And so these people are frequently labeled as fibromyalgia, but I have yet to see a single case in my career where a fibromyalgia case did not have hypermobility underneath it. And so the problem is weakened joints causing this problem, and we applied the therapy. And what have you been able to do since?
My life has changed completely. Even going to a movie was really tough. It was probably about 3 years before I really came to see Dr. Faber that my back was hurting, and I just even sitting in class, going to a movie, driving anywhere, like in a car for more than half an hour, was just very difficult. At this point, I've gone on long trips cross country, rode my recumbent bike about 1,500 miles on a trip. It just really changed my life. It's not really something I don't really think about my back anymore.
Mountain climbing, snorkeling?
Yeah, a lot of snorkeling. My back was always on my mind before, and it's just not something I even really think about, other than, trying to take care of myself.
Well, congratulations,
Thank
Peter,
you.
for helping yourself and hopefully helping other people to realize that there is a way out of the fibromyalgia great mimicker.
Yeah, thank you.
And it's really joint instability, in your case complicated by a genetic hypermobility syndrome, which can be overcome with prolotherapy and neurofascial therapy. Congratulations.
Thank you.
Thanks for sharing.